Tonight, the country experiencing an early flu surge not seen in a decade as COVID cases rise, now draining supplies and hospital resources.
The flu numbers this year are through the roof.
Some taking preemptive measures as they face holiday crowds.
Very grateful that there's a vaccine, and we are vaccinated and boosted and flu shots and all that.
Other New York City visitors taking in the holiday sights and taking even further precaution, heeding the latest advisory from the city's health officials to mask up indoors and outside in crowded places as viruses bear down on the holiday spirit.
Did that play into your plans today?
Well, absolutely. As a matter of fact, we wear masks when we're in places with high density populations of people.
Flu numbers already raising alarm bells here.
I think we're worried and concerned that this is only going to get worse and that we'll have to think about how to make the hospitals available for all the patients that need it.
In upstate New York, the flu infiltrated Kristen Hawes' home. She and her husband recently recovering, not long after their newborn was hospitalized with RSV.
When each of us were sick, we didn't go near the baby, which was difficult to not hold your newborn.
In California, Los Angeles County is facing a potential indoor mask mandate in January if COVID hospitalizations rise there. The triple threat of the illnesses already hitting patients and staff.
We are having significant numbers of people in the waiting room for much longer than we are accustomed to, simply because so many ER nurses are out.
Kentucky seeing an alarming spike in flu cases.
Last year, we only had 4 flu cases and 0 deaths, and this year we have way surpassed that already.
Almost the whole country experiencing what the CDC calls high or very high flu rates, all while COVID cases are creeping up.
We are seeing an uptick in cases, followed by an uptick in hospitalizations.
Still low compared to the rest of the pandemic, but moving in the wrong direction at the wrong time. ICU nurse Ashley Porter reminding everyone of the basics.
I think it's important that you be mindful of, being around people who already have, current illnesses, and just washing your hands, covering your mouth, not going places when you're sick.
All right, Valerie Castro joins us live tonight from outside a hospital, Mount Sinai West here in New York City. So, Valerie, you mentioned rising COVID rates as we approach the holiday break for both workers and school-age children. What are doctors recommending?
Well, doctors say now is the time to get vaccinated, get boosted, as well as getting your flu shot. Those vaccines can take up to 2 weeks to become fully effective, and you want to be fully protected before any family gatherings.
And, what's the advice for those holiday gatherings this year? I know a lot of people are tired, and they're being tired of being told what to do.
Well, the doctor we spoke to here at Mount Sinai says don't forget that it was around this time last year that Omicron was hitting. He says pay close attention to any symptoms you might be having, and if you do feel sick, you should just stay home. As for the flu, he warns it is affecting people of all ages at this time. Tom?
Yeah, the flu seems to just be spreading so fast. Okay, Valerie, thank you for that.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.